Hello, everybody. Thank you for joining this virtual booth on disability inclusive social protection system in the COVID-19 crisis and beyond. My name is Alex Scott. I am the technical coordinator for the UNPRPD program on inclusive social protection, implemented by ILO UNICEF. And this virtual booth is also sponsored by the International Disability Alliance, as well as the GLAD Network on Disability and Development. Since we are a small group for the moment, I was thinking that maybe we could do a quick round of introduction. And including for, we will start with our speakers, but then people would just join, might want to introduce themselves. And if you have any questions or related to the booth, and you can already share them with us. So maybe Abner, can you introduce yourself?
Good morning, everyone. I am Abner Manlapaz from the Philippines, and I work for Life Haven Center for Independent Living, but also a fellow of CIP Center for Inclusive Policies and council member of the National Anti-Poverty Commission. Nice to meet you all. Thank you.
Thank you. Meenakshi?
Hello, my name is Meenakshi. I work as a fellow with Center for Inclusive Policy, and I am associated with Equal Center for Promotion of Social Justice India, through which we do the budget and policy analysis in India. Thanks.
Thank you. Sinta.
Hi, my name is Sinta Satriana. I'm currently working for Mahkota program in Indonesia, and we've recently conducted a quantitative and qualitative study on the impacts of COVID-19 on people with disability and their access to social protection. Thank you.
Thank you. So I see on my list of participants, Lydia Domingo, Katia Tala, Joanne Sharp, and yep. So maybe Lydia, if you would like to introduce yourself, and if you have any specific question.
Hello, good morning. I'm Lydia Domingo. I'm with the Asian Development Bank, Social Development Office. Thanks.
Okay, nice to meet you. Katia, or yeah?
Hi everyone, sorry. Good evening, well, I'm from Peru. I'm currently working at UNICEF LACRO in the social policy department. I'm happy to be here. I would like to learn more about inclusive social protection systems. That's why I joined this virtual booth. Nice to meet you.
Thank you. Joanne Sharp.
Hi there. My name is Joanne Sharp. I work for the Social Protection section in the Department of Foreign Affairs and Trade in Australia. I'm currently working from Thailand, so I'm here in Bangkok in the region. And I'm really here to hear about, just to join the virtual booth session and learn a bit more. Thanks a lot.
Thank you very much.
I should say I may have my video off on and off because I have children in the house that might get a bit distracting. So if that happens, that's why.
No worry. Thank you very much. Felicity.
Hi everyone. My name's Felicity O'Brien, and I also work in the social protection in the Department of Foreign Affairs and Trade in Canberra, and look after gender and social inclusion issues to do with social protection and cash for work programs and community-driven development. So just dialing in to hear the wonderful Alex speak again, and looking forward to the session today. Thanks.
Thank you very much. So what we will do today, we will have a short introduction on some key elements with regards to social protection and person with disabilities. And then we will have 3 quick presentations from India, where we will hear about the evolution of the response to COVID-19 for persons with disability from the state of Tamil Nadu, who is in the south, which is in the south of India. We will then go to the Philippines, where we will hear the different mechanisms that exist in the Philippines in social protection in response to COVID-19 and the gaps and the actual developments that are, the current development that are taking place in terms both of advocacy and policy process. And finally, we will have a presentation with fairly recent and I think quite exclusive at international level insight on the impact of the COVID-19s due to the research that Sinta and the team of Makota have done together with some organization of persons with disabilities. And after that, I suggest that we go into a conversation with maybe some more specific question that you may have to any of the speakers and a broader discussion on how social protection system can better support persons with disabilities. We have, after this session, we will have a clinic on gender and disability with other experts, where we will have also the opportunity to tackle more questions. And later today, we have the roundtable 13, where we will have presenters, speakers, field practitioners from Lebanon, from Fiji, from Kenya, from Syria, and the Dominican Republic as well. So without any further ado, looking at the first thing we need to say, and that's I guess part of the narrative that we want to share for this conference, is the fact that before COVID-19, persons with disabilities were already facing strong inequalities. On the screen, I just put words. We could show you graph showing that in any country, persons with disability are less likely to work and less likely to access and complete education than persons without disabilities. The gap is more or less depending on the country, but it's present systematically in every country. They are also more likely to be poor, more likely to face catastrophic health expenditure, and more likely to be victim of violence. And one of the key concepts that we believe is really critical for understanding how social protection can better support persons with disabilities are the disability-related costs that they and their family face. And those disability-related costs can be specific to disability, such as assistive device, personal assistance, housing modification, sign language interpretation. But they can be also more expenditure on general items, greater need for healthcare, greater cost in transportation because public transportation are not accessible, or for instance, paying more on housing because you need to be closer to services, especially in low and middle income countries where support services are available mostly in capital city or major urban centers, which push people to move to cities even though they might not have the means to do so. And this is particularly true for parents of children with disabilities. But they also face opportunity cost or indirect cost. As we said, persons with disability have less employment opportunities and less education opportunities, which leads to lower earning in average. But they have also, within household, a significant loss of earning or education opportunities for family members who are providing support and care. And those costs can be measured in 2 ways. We can look at currently what are the costs they face, and in low and middle income country, especially in the lower decile of the population in terms of income and consumption, there is not much difference between family with and without disabilities. There are differences, in terms of what kind of standard of living a family with a person with disability can achieve with the same income, but it's not that pronounced. And the reason for that is that people just have no capacity to pay, and there is very little services available. But when you look at either people in the higher decile of income and consumption, or if you ask people, what would you require to achieve a basic participation like your neighbor, then the numbers are climbing. So in the screen, I project two bars, a blue and an orange bar for blind people, deaf people, person with deaf blindness, person with physical disability with moderate support needs, or person with disability with high support needs. And the blue bar are the minimum cost, basically what they face when they stay at home and do nothing. And this is from a study 2015 in South Africa. And the orange bar are the costs that people face when they actively participate. Access to education, work and employment, access to different forms of services. And we see that the blue bar, those minimum costs of staying at home and doing nothing, is basically, for most of them, are below poverty line. But if we look at the cost of participation, they go up to 15, 16 times the poverty line for all groups. And it starts with blind people that had quite low level of cost at stay at home, and they have 4.5 times the poverty line in terms of cost when they seek participation. And it's particularly true, as we see, for deaf person and person with deaf blindness who need sign language interpreters or guide interpreter, who are very costly in most low and middle income countries with very little publicly funded system. So it's very important when we look and design at social protection system and schemes that we are looking not only at what people are facing today, because today they are excluded and they don't participate, and individually or within the household, they are in poverty. We need to look at what would it take for a person to achieve the basic level of participation, which is a chance to go to school, a chance to get a job, a chance to participate in basic community activities. And that changed a lot, the perspective we have on the adequacy of the benefit, but also the coverage and eligibility criteria. So what do we expect from social protection system across the life cycle for person with disability from the perspective of the Convention on the Rights of Persons with Disabilities? First, basic income and adequate standard of living. 2, coverage of healthcare costs, including early intervention, rehabilitation, and assistive device. 3, coverage of other disability-related costs, including access to support services, such as personal assistance. And last but not least, facilitate access to early childhood development, education, and economic empowerment programs. The challenge we have today is that in low and middle income countries, the coverage is very low. Less than 20%, 1 in 5 persons with severe disability receive any disability-related benefit in low and middle income countries, and it's 1% in low income countries. So we have very significant gap, and we have very big geographic discrepancies. For instance, in Eastern Europe, we have quasi universal coverage. Latin America and the Caribbean, we are below 60%. Central and Western Asia, below 30%. And when you go to South Asia, Sub-Saharan Africa, you are below 10% of coverage. And that reflects, this comes from a work done by ILO in 2019 on the financing gap for SDG 1.3, but it reflects also what we have been documenting in the recent years. And not only there is a problem in coverage, there is also a significant problem in terms of design. We have many schemes which are conditioned by incapacity to work, which means If you want the disability benefit, you need to prove that you are not able to work. And if you take job, or if you want vocational training, or if you want any productive activity, you will lose the benefit. There are significant issues with eligibility determination, especially with regards to disability assessment, required very often to get disability benefit, which in most countries still rely on medical certificate, which is a significant barrier for many persons with disability because it's difficult to get, but it's also a very medical approach to disability, focusing on the impairment of the person rather than focusing on the support requirement that this person faces to participate. There are also barriers in design, such as conditionalities, but also in delivery of social protection with inaccessible information. With digitalization, there are issues of accessibility of websites, application, ATM machines, etc., etc. Very often, the design of schemes and eligibility determination threshold do not take into consideration disability-related costs, and overall, there is a lack of publicly funded community support services. So, altogether, different agencies like ILO, UNICEF, DPOs, ESQA, ECLAC, ESCAP, and others have developed a joint statement in 2019 towards inclusive social protection system. You can find it, the link in the booth page, where we try to detail what we expect from social protection system from a rights-based perspective. The last thing I wanted to share before we move to our speaker is the first element we got from the COVID-19 response. A good thing I would say is that a third of the country who have announced measure on social protection as response to COVID-19 crisis had a focus on persons with disabilities, mostly ad hoc cash transfer measures, and mostly from countries who already have a system in place, of course. And we saw, unfortunately, that in low and middle income countries, there have been a somehow muted response, simply because the social protection systems are not designed to actually support persons with disabilities. It's especially the case in countries where there is no disability registry or very limited one, and there is no, for instance, disability card system or equality of opportunity card system, which allow government to actually identify persons with disability for quick response. We have seen also that countries that have universal or quasi-universal disability allowance have been in a better position to provide direct relief, very often by quick top-up, which have an impact, of course, on persons with disabilities, but also their household. So they have proven, like child grant or old age pension, a quite effective tool for shocks responsive social protection. And as mentioned, we saw the dramatic impact of the gap in publicly funded disability support services, with people with disability facing very severe disruption of their support system. So to exemplify the response and how countries or subnational entities have realized the gap of systems and trying to fill those gaps, we will look at India, we will look at Indonesia, and we will look at the Philippines. So I would like to introduce Meenakshi from India. If Meenakshi, you could get us through in few minutes what has happened in Tamil Nadu with regards to the response to COVID-19.
Yes. So the pre-COVID situation in Tamil Nadu, we have the Union Cash Transfer, the National Social Assistance Program, and the state-specific cash transfer. But it covers, the National Social Assistance Program covers only 4.85% of persons with disabilities, and the state scheme covers 24.97% of persons with disabilities. This is the pre-COVID situation. Once in March, the initial cash transfer announcement came from the union government, which is one of top-up of the National Social Assistance Program, through the Indira Gandhi National Disability Pension. And at the state level, there wasn't any cash transfer, but they have come up with helplines and distribution of essentials for persons with disabilities through the helpline. And in April, the state government, the Tamil Nadu government, announced for an advancing of the disability state-specific disability allowance that was for persons with high support requirements for 2 months, basically. This was the announcement. And in July, again, as the lockdown continues and as the work couldn't be resumed for persons with disabilities and a majority of population, they announced for a one-off cash transfer for all persons with disabilities in the state who possess disability ID card, irrespective of any income ceiling or any criteria on the nature of impairment. Then in September, recently what they did was, they announced that the state level pension or the state level cash transfer will be extended to all persons with disabilities who have 40% and above impairment and who have disability ID card. If you look at the union pension, it is only for those with more than 80% impairment. So what they did at the state level is that for those with 80% and above impairment, they have said that they can receive both the state and the union pension. However, there is an income ceiling of 300,000 Indian rupees per year, but the government order to this effect is yet to be received, or any communication from the government is yet to be received. But there is a commitment to this effect, basically to relook at the cash transfer in Tamil Nadu for the future, which is not an emergency response measure, but as a recovery and a sustainability plan. Yes, Alex, thanks.
Thank you very much, Meenakshi. Just one clarification for our participants. The ceiling of 300,000 Indian rupee. How many times the poverty line is this? Approximately. Meenakshi?
More than
we
20 times? Yeah, I can.
Yeah.
It's so, more than, it's more than 10 times, like 10 to 15 times more than the poverty line.
So 10 to 15 times poverty. Just important to specify. So the income ceiling is really an affluence test. It's not a poverty targeting. It's really an affluence test, excluding the richest or the better off, and focusing probably on at least half of and more of the income decile distribution.
But another assumption is also that for more than people earning more than 300,000 will be getting tax exemption because they get into the tax bracket.
Exactly.
Yeah, so that could also be one of the reasons.
And what I find absolutely staggering and great in this evolution, and we are talking about 6 months, is how the response to COVID-19 and also the realization by the state of the limitation of the existing social protection system lead from a very restricted coverage to quasi-universal coverage in the time of 6 months. And that, I think, is really a great reaction. Maybe a few points. What has been the role of DPOs in trying to change that?
Yes, so initially the DPOs were involved in the production of an evidence-based document. And then some of the DPOs have filed a strategic litigation in the High Court of Chennai, like Tamil Nadu. And then they also engage with the government, both both in conversation and also in resisting the government to pass it immediately And this happened across the state, like in all disability offices at the subnational level, people gathered and made a similar demand. So,
so basically a combination of data crunching and evidence-based work, litigation, as well as political activism at local and state level. And with really a strong engagement in changing the status quo. Thank you very much, Meenakshi, for this presentation. Is there any specific question for Meenakshi with regards to this journey of Tamil Nadu? No? Okay.
Hello?
Yep, Katja?
Hello, Alex? Yeah, I was wondering if prior COVID-19, the ID disability card was also part of the requirement to access to the Tamil Nadu, if I'm not wrong.
Yes. Yes, actually having a disability ID card is a precondition for accessing any social protection program for persons with disabilities.
Thank you.
But how this process of I mean, I was also wondering if the COVID-19, because of the new challenges, reshaped the selection process of beneficiaries in this case.
That's also one of the challenges that the government is facing right now. And we did a rapid survey of the one-off cash transfer. And we found that some of the coverages, like it has moved from 24.97% to more than 50% once they made it universal. But there are problems with the disability certification process, as many persons with disabilities have not accessed, particularly those who have been recognized as persons with disabilities in the Rights of Persons with Disabilities Act 2016 and not before. So they find it difficult. So right now what the government has done is, in the September commitment, they have said that by October 15, they will come out with a protocol, like to make the disability assessment process completely online, and they will come up with a process for accessing disability certification and ID cards by persons with disabilities. So we are looking forward for that, but that is an important issue.
So this element of facilitating access to the disability assessment within the COVID-19 response, we have seen, for instance, in Brazil, one of the measures they have taken, which is normally you cannot get the benefit before you do the assessment. And in Brazil, they announced that actually you can provisionally get the under certain condition, you can provisionally get the benefit while you are doing the assessment, acknowledging that it takes in regular time, it takes a lot of time to get the assessment. In Brazil, it's fairly complicated. And with COVID-19, things are even more difficult. Thank you very much, Meenakshi and Katja, for this question. And now we will go to Philippines. Abner, can you tell us a little bit in few minutes what people with disability can use in the social protection system with regards to COVID-19? What is regularly there, what is specifically there for COVID-19, and what are the challenge, what is missing, and what you have been proposing, and where we are now. Abner?
Sorry. Hello?
Hello?
Yeah. So in the Philippines, can you hear me now?
Yep.
Yeah, thank you. So in the Philippines, we have several social protection wherein persons with disability will benefit for as long as they are qualified to the program criteria. So we have the conditional cash transfer, the 4Ps, which is more of a child support. And it is, we all know that conditional cash transfer is poverty targeted. And then we also have the social pension for indigent older persons, which have priorities for older persons who has a disability or sick leave. But there is no regular income security at the moment. with regards to working age people with disabilities in the informal sector. And then we have the some assistance, financial assistance to cover some of the disability-related costs, which we call the assistance to individuals in crisis. Actually, this is a regular program of the government available to the whole population if you are in distress. So it's not only covering disability-related expenses, but also when suddenly you are out of job, so you can apply for some financial assistance. It is also used for medical assistance. So persons with disability who oftentimes have additional healthcare costs, they always use the assistance to individuals in crisis to get subsidies for the expenditures they are facing. And assistive devices can also be obtained through this program. Educational assistance is also obtained using this program. And in the local level, there are some local governments who have a good auxiliary social services. So they provide like transportation support, assistive devices, and many other things. And then we also have the discounts for persons with disabilities and older persons. So this can cover some of the disability related expenses because the money you save out of it can be used for other purposes. And then we have the universal healthcare, which was passed last year. So all persons with disability do not have to pay a contribution to become member of this program. And more importantly, the healthcare law is also specifying that the health insurance should develop disability specific benefits, like we already have the uh, packages for children with disabilities to access free rehabilitation services, assistive devices. So, and then they have to expand it to other disability specific needs. So that covers some of the disability related costs when implemented in the while developing the services for the future. So what we need is you know, people with disability face a lot of extra costs. Alex in the beginning mentioned about uh, the support to access education, the support to access work, and the higher cost of transportation, personal assistance, and other support services. So it is not yet being covered by existing social protection programs. And accessing the auxiliary social services or the assistance to individuals in crisis is very difficult because every time you have to submit documentations like uh, you may need to submit medicine prescription and other documents of that prove that you need all those uh, that you need the financial assistance you are requesting. So it's very difficult for many persons with disability to comply, especially when the uh, healthcare facilities is very far from where they live. And during the COVID-19, uh, so the government adopted the social amelioration program, which is about cash assistance, food and non-food, and various livelihood programs coming from different government agencies. The good thing about the social amelioration program is that there was directives that persons with disabilities have to be prioritized in food and non-food. And when we talk about non-food, they were talking about medicines, maintenance medicines, vitamins, transport support, uh, and other things. So, but for cash assistance, it's not sufficient to cover the extra costs which persons with disability are facing even during COVID-19. And in two of the quick survey we conducted, people expressed that the cash, for those who received the cash assistance, they were the amount is not sufficient to cover those extra costs that they are facing even before COVID-19. So that is the problem, and as well as the disability registry is not well established. So there is really no national registry, and the local registry was not utilized in the targeting of persons with disability. That's why many persons with disability uh, who have needs additional support, they were not able to get the support because the current system is only targeting household and not considering the extra costs faced by persons with disabilities. So because of this, we are now proposing for a universal disability allowance. It's an ongoing dialogue with different stakeholders, from government agencies to politicians, and we are already asked to uh, contribute by drafting the proposal for the disability support allowance. There is a proposed bill already in the Senate whereby they want to provide social pension for poor persons with disabilities, but we want that to be designed to make sure that it serve as an income security for the currently unemployed persons with disability, but as well as if ever that persons with disability gets employed, it becomes support to make sure that it covers the extra costs for keeping the job. Thank you.
Thank you very much, Abner. Mindful of the time, because we have the session just after on the clinic, and we have the same interpreter, Susan, with us, and we need to give her a break. I will go straight to Sinta to talk to us about Indonesia, and then we will conclude with a few questions. Sinta?
Yeah, thank you. So this will be a very brief presentation of the findings of our research, and I'm happy to discuss in more detail in other times when we have more time. Yes, next slide, please. So we did a qualitative and quantitative assessment of the effect of COVID-19, the economic effect of COVID-19 to people with disability, given that the existing social protection programs prior to COVID-19 for people with disability have had very limited coverage, and many programs are poverty targeted and household based, so not reaching people with disability as much as we want. So we want to know whether during the COVID-19 crisis this has changed, and how the government response have affected people with disability. First is the impact of COVID-19 on people with disability. And this is not surprising, of course, but just to emphasize again that on the income shock, there's, of course, a lot of job loss, but we found that there's higher job loss among people with disability compared to general population, partly due to the informal nature of their occupations, because most of the people with disabilities in Indonesia are working in the informal sector, and they are much more affected. And we found that 87% of respondents in the quantitative survey experienced a reduction in income due to COVID-19, and most of them actually experienced very drastic decline of more than 50% of income. On the other side, there's also the expenditure shock. Alex explained to us how the expenditure, how the cost of living for people with disability is higher. But during the COVID-19 crisis, we found through our qualitative study is that this is even magnified because there were certain goods and services that they needed related to their disability became more expensive and or difficult to obtain. And this includes certain food or supplements, private transport, the usual public transport that they had to, they normally take is not available anymore, certain assistive devices, therapy. There was a time when, a period when formula milk was not available, and this was impacting persons with disability who are not taking solid food, for instance, and that's one of the findings we found through the qualitative study. So this is further increasing the high cost of living for people with disability. Next. So this is before we actually take into account the higher cost. We found that up to 69% of respondents may have become poor or fallen deeper into poverty due to the low baseline income in combination with the high drop of income. So you see here the red, pink boxes is where you have relatively low baseline income and high income reduction. And that would, even if your income is consumed by one person, that would put you under the poverty line. This is using the poverty line 2019. And furthermore, there are people in the yellow boxes which are slightly under or around the poverty line as well. So they're also likely to be poor due to the COVID-19 crisis. And this is showing how dynamic the poverty situation is for people with disability, and looking at how poverty targeted most programs are. This is showing that this is not working in this particular situation for these people. We also found that women are more vulnerable to poverty during COVID-19, although men experience almost the same or slightly higher income reduction. This is because the baseline income of women is significantly lower than men with disability. So you see on the pink boxes here, where you see significant difference in the number of women estimated to be in poverty versus the number of men. Next. So the government launched a lot of COVID-19 response programs, from expanding existing cash transfers or food voucher programs, free or subsidized electricity, and new cash transfer programs at national level. But what's different is that the government launched a program requiring villages to use some of their village funds, a certain percentage of their village fund, as cash transfers for people considered affected or impoverished by the COVID-19 crisis. So when we first did the survey in April 2020, most of these programs are not rolled out yet. So we were still looking at three main programs that were the extension of existing programs, and plus the electricity subsidy, which was immediately rolled out. And we found that 41% of respondents were accessing at least one of the three programs. And this is, if we look at the number of people affected by COVID-19, this is of course very, very small. But by July 2020, when we had the qualitative survey, we found that most persons with disability that we interviewed received some sort of social protection. And this is mainly because of the combination of the national, local, and village level assistance. So the national program, we found, missed a lot of people with disability. And most of these programs also do not have specific focus on people with disability. And the database system, the targeting system is very problematic to identify people with disability. When you have the village funded cash transfer programs, this program has community targeting where people at village level decide who gets the cash transfers. And this is a 600,000 rupiah cash. And we found that a lot of the villages find people with disability as a priority, and they are able to identify people with disability who would otherwise not be reached by national program or even district programs. So many of these social protection beneficiaries actually benefited from the village level and local level programs. And at the village level, it's actually the only point where you can see who is getting what. So the national government cannot see who's getting the low programs provided at lower level, and district governments don't have either higher level or lower level program information. But at the village level, they actually have the list of names of recipients of all programs, and they can really filter who's getting a program and cover whoever is missed out by the village funded programs. So this local and village funded schemes, especially the cash transfer ones for 600,000, have been a lifeline for many vulnerable people with disability, because if you can see previously, most of the respondents have an income of 1 million rupiah, 1 million Indonesian rupiah or less, and the 600,000 Indonesian rupiah have become a significant amount of assistance for them during the COVID-19 crisis. Next.
I don't think I have next. Thank you very much, Sinta. I will just go straight to, if there are few questions for the few minutes we have remaining on this virtual booth. I invite also colleagues, you can join the clinic on disability and gender. Meenakshi, Abner, and Sinta will be there also to continue the dialogue. But is there any question right now for Abner or Sinta? No. Sinta, just one question. Will there be a report published with, or has it been published already?
So we have a report from the quantitative survey that's available. The qualitative findings, it's being written now, and we're hoping soon we can have the second round of the quantitative survey. So we will have a proper panel data. So we hope by the end of the year we have a more comprehensive report consisting of several policy briefs. But yeah, the first quantitative report is available now. I think soon it'll be available in DFAT's website as well, but for sure in Mahkotas.
Okay. Yeah. Thank you very much, Sinta. So thank you all. 1 hour is actually very fast. I hope that the presentation of Abner, Meenakshi, and Sinta gave you an insight on the challenges faced by social protection system to support people with disabilities, but also the way forward. We saw the evolution of Tamil Nadu towards a universal or quasi-universal disability allowance. We saw the dialogue engage between organizations of people with disabilities, parliamentarians and executive in the Philippines to set up a universal disability allowance. And we saw also the importance in a country that do not have a national disability registries as of yet, like in Indonesia, the importance of community involvement in targeting to ensure that people with disability access benefit. And we saw that those locally identified benefits had a big impact on persons with disabilities. So with those words, I will close this virtual booth. I invite you to look at the page. We put many links. There are also links to videos. There are animated videos on social protection in general and disability-related cost. And you can join us also in the clinic after, and as well as the Roundtable 13, which is a bit late for Australia and Bangkok. It's 6 p.m. Rome and Paris time. Thank you very much to all of you, and I wish you a good remaining of the conference. Susan, yeah, so I invite you to connect to the next one. You got the link for the clinic, and I think we will start a few minutes late. So I expect that you will be able to have 5 minutes. I was really rushing, trying to get you more.
No worries.
Okay, thank you very much for this.